Welcome back, guys. This is Mimi, and let's talk about having a baby at the public hospital, the Maternal Infantil hospital, located here in Mérida, Mexico, about 30 minutes away from where we lived in Cholula. But let's just talk about what that looked like, what the cost was for us to be able to have two babies, twins, by cesarean section, and what it looked like. So if you're a mom that is so happen to be in Mérida and you go into labor and you don't have the finances for a private hospital, because the way it works here in Mexico, you need to pay for your services when you're having them. So when you go into labor, you need to pay for labor when said labor happens. If you have a medical emergency, you need to pay for that emergency when that emergency happens. And so you may not have all the resources, and some of those things can add up, especially when you're talking about major surgery like a C-section or just having babies. So typically in the States, I know when I had my children, my bill would be, even with insurance, because I've had the privilege or the ability to have children in different times of my life. So there was a time when I was young and I had no income and I had a baby with Medicaid, and then there was a time that I was older and I had income, and so I used private insurance, and that was I had one baby with United Healthcare, I had a baby with Blue Cross Blue Shield, and all those experiences need to say cost the same amount of money, except it just determined what I paid out of pocket. So of course with private healthcare or private insurance, typically we paid, you had to pay the copay, the co-insurance, if I didn't max all that out during my prenatal time, and if it didn't happen in the same year, which sometimes it didn't. I'd get pregnant in this year and I have the baby till the next year, so then everything will reset, blah, 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 blah. So you know how that goes if you ever dealt with insurance in the US. But anyway, let's get back to what we're doing here in Mexico. Here in Mexico, we didn't have any insurance, and nor did we plan to have babies in Mexico. When we came to Mexico on Halloween in 2024, we came because I was sick and I was dying. Literally, I could feel myself dying and dwindling away. I had started having seizures for the first time in 20 years. And my heart was always racing. I was sick. I couldn't eat anything. Like I could barely eat anything. And I was just at a very, very low place. And we had to make a decision. Are we going to stay here and continue to live this life where we're always fighting for money to give away to someone else? Or are we going to just maybe take some time and just focus on healing and finding ourselves and figuring out what we want to do? And so we decided, well, let's go to Mexico, because every time I come to Mexico, I feel like I'm at home. I feel a certain level of peace that I've yet to ever experience in the United States. That being said, I'm not saying that I hate the U.S. I'm not saying that people who live in the U.S. should move to Mexico. That is not what this video is about at all, because everybody should make their own choice. For us, my desire is to slow travel the world. This is a huge world. I do not feel like I should spend my life in one place. If I'm going to be here for 70 years, I want to have different years. I don't want all of my years to look the same. So hence why we ended up in Mexico. And our next stop is Southeast Asia. But we're taking a pause because we just had two babies, los bebés, 2 semanas, 2 weeks ago. And so we're really excited about that. Titus and Thane, they are our grandbabies. And while we didn't know they were going to come here and be in Mexico with us, here they are. And we're excited about that. So let's talk about what that looked like. So when I got the call from my daughter that she was going to be having babies, we were immediately like, well, I guess you need to come here with us because you're going to need help and we're not coming back to Texas. And that's what happened. So she came on down to Mérida with us. And again, because I had stopped working, income looked completely different. We went from a 2-income home to a 1-income home, and that's an income that is based off of VA disability from being a disabled veteran. And so, you know, if you're a disabled veteran, you know it's not a lot of money. Even if you're a family of 6 or 8, whatever, it's still not a lot of money. It's enough to do what you need to do. So here in Mexico, we're able to budget our lifestyle and live accordingly. But when things happen, you need more money, and we didn't have that. So being able to go to a private facility, we started out with private care. We started with Dr. Felix, who is most immigrants that I've come in contact with use him, or they use midwives, do home births. But for us, because she was having twins and this was her first pregnancy, we did not feel comfortable with that. So we X'd that out immediately. That was not an option. We needed to just pursue private care just to make sure things would be taken care of. So every time we went to see Dr. Felix, in which he wanted us to come every 3 weeks because she was pregnant with multiples and this is her first pregnancy, it was 800 pesos. So we would go in, they would do an ultrasound every single time and check the babies and just weigh her, typical stuff, and send us on our way. Anytime we needed to do labs, he would give us an order for the labs on a little slip of paper, and you figure out where you want to do your labs at. There are plain options for labs. You can have somebody come to your home. You can go to different facilities, but where we ended up rocking out the most with, because they're the most affordable, is Salud Digna. If you don't know who Salud Digna is, look them up. You can do anything. I like to call them DMV of healthcare here in Mérida, because you can get, I went and got eyeglasses, but you can get your blood work. You can get a 4D ultrasound for like 315 pesos or something like that. Really, really inexpensively. So we would go to Salud Digna and get our labs, and then they would text and we'd send them to him and blah, 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 that was that. Well, once we got to the third trimester, the reality set in that we were not going to have the money necessary to have a birth at the private hospital, which was going to run us about 4,000 to 5,000 USD for the twins if we had to have C-section. That would cover the hospital stay, the doctors, the anesthesia, and things for the babies and everything like that. Well, that wasn't our reality, so we needed to look at other options. So we started exploring the public hospital. So we started at Oran, and we went there, and then we went to the maternal hospital. And let me explain something to you about the public hospitals. There's no rhyme or reason for anything they do. You're going to get a lot of mixed information, just like you would if you were in the States going to the health department or anything like that. So you really can't have any set expectations. Even if they tell you something, it's maybe not going to be so just know that. But however, stay tuned, because I'm going to tell you the cost after I talk about this experience. So we started going to the maternal hospital. Again, this is down, I don't even know what part of Mérida. It was like 30 minutes from us. It's on a side of town that we're not familiar with, and there is not a lot of English spoken widely. So Andrea went with us, and she did a lot of our interpreting and went in, but they do not let you in. If you're not the patient being seen, you do not get to go in. So I had to sit outside, literally outside of the hospital, outside of the building, and wait. Even though they had plenty of waiting rooms, you cannot wait in the waiting rooms unless they say you can wait in the rooms. I don't know. You have to be privileged to wait in the waiting rooms. I guess they're more so reserved for the patients and not the family. So the family typically you'll see sitting outside. So if you're at the public hospital and you wonder why everybody's sitting outside, that's because that's the waiting area. That's where they're going to be. Anyway, so fast forward, we did some visits there. They wanted us to even though we had just had labs and we were seeing Dr. Felix and we had all this stuff going, they still wanted us to get the labs and stuff done again. And we're like, well, we just paid $80 for labs. That's not realistic for us. And they wanted us to do them with their provider. And so they wanted more for the ultrasound and the labs than they do for the visit. A typical visit, if you're just going to get a checkup, will cost you 127 pesos. So 127 pesos and 20 cents. So that's, basically what, I don't know, something. I can't do the conversion in my head right now. But so I'll put it on the screen maybe. But 127 pesos for a visit just to get a checkup. Cool. Not bad at all. But then there's, they wanted like 600 pesos for the ultrasound. They wanted like 800 pesos for the labs. And mind you, we had just paid Salud Digna to have all these labs done. It hadn't even been 30 days, but they wanted their own. Everything is handwritten. So like, it almost looks like it looks like this. I'm gonna do it fast because I don't want you to see our information, but it's almost like a WIC folder. If you've ever done WIC in the US, which I had the privilege of doing when I was 21 and had my first baby. That's what the folder looks like, and then they just write everything. So everything is written, even down to when she was being discharged from the hospital. So much stuff was written. I'm like, I don't know how you find anything if you need to gather records. But anyway, let's go to the day she went into labor. So we did the visits and everything like that. They were pretty standard. The biggest thing they were urging is they wanted to do a C-section because she's pregnant with twins. Okay, so back to it. Just had to take a break to reset the time. So the day she went into labor, it was a Sunday. We were having dinner. She had just finished eating. She went to the bathroom, and then she came out and she had this look on her face. I'm like, what's wrong with this? She's like, oh, nothing. Just a little cramp. And I said, oh, those are probably contractions. Let's check that out. So we started timing them. They were 5 minutes away, literally 5 minutes apart. Excuse me. And I'm like, okay, we should go to the hospital. So immediately we head down to the public hospital. It's probably about 9 p.m. at this time on a Sunday. Again, the hospital is about 30 minutes away, and we had to wait for Andrea to come get us because we were at a friend's house. So she went and grabbed, again, because this is your entry. So she went and grabbed our entry ticket because this is the only way she'll get in and be seen without hesitation or a lot of extra. And we went to the hospital. So when you're going into labor at the maternal hospital, the normal side that you go in for your consultorials and stuff, it closes like at 2 or 3. So you have to go to the urgency side or the emergency side. So we went there, they took her back, and the whole time we've been asking, when she goes into labor, will I be able to be in the room with her, or will she have to be alone? And there's like, yes, one person could be with her. She will not be alone. One person can be with her. This was the furthest thing from the truth that we were told. I guess their version of one person being with her is one person waiting on site. And on site means in the waiting room with no actual visual or audio contact with your loved one at all. Okay, so let me explain to you how this really threw me for a loop. And it really surprised me because Mexico is so big on family that it really shocked me that they would make a mother labor alone. But that is what happens if you go to the public hospital. Now, if you go to the private hospital and you have the funds, you can have an army in there if you want because you're paying and it's your choice and it's your doctor's choice. So you work that out with your doctor. But when you're going to the public hospital, you have no say. You were basically, it's almost like having a baby in prison, is what I felt like, because they whisked her back and that was it. And we were told, no, you can't come inside. You just need to wait in the waiting room, and only one person could wait in the waiting room. So it couldn't be me and her dad. It couldn't be me and Andrea. It had to be either me or Andrea. So Andrea waited in the waiting room for the first 3 hours because, again, want to make sure we're getting all the communication. I don't speak Spanish well, so I didn't want us to miss anything that we needed to know. But I was livid sitting outside in the truck just wanting information because, again, you told me I'd be able to be there with her. She's 19. She's having these babies for the first time. She doesn't speak the language, and you're whisking her off, and there's nothing I can do except just sit here and wait. And I feel like I'm about to snap. Like, I'm shaking. I'm upset. I'm like, I do not like this because I want to know what's going on with my kid, like, now, and these babies, like, now. I want to see myself. Like, I want to be there. And that was not an option. So we get there and they take her back and she's 10 centimeters dilated, and baby A, which is staying, his feet were already in her birth canal. So they whisk her off to have a emergency C-section. Well, at this point, we're still sitting in the truck. It is about 10:30-ish or so. And they do updates at the public hospital. So for these updates, you physically have to come to the hospital, to the waiting room, to receive the updates about your loved one. The updates are given at 11 p.m. So again, right now we're at that 10:30 window. So we're waiting for this 11 p.m. update. And the next one would be at, was it 11 a.m.? I think there was a morning one. I cannot remember, y'all. I think the morning one was maybe 8 or 9. And then there was another update at 11 a.m. And then at 5, from 4 to 5 p.m. is when you can visit your loved one. This one, and it's not even the full hour. The waiting room opens at 4 p.m. for you to come in. From 4:30 to 5, you get to visit your loved one. And then you get your update at 5 p.m. And then you can come back at 11 p.m. for an additional update should your loved one still be staying in the hospital. So needless to say, you're telling me my daughter is about to have 2 babies, that you're taking her back there to have a C-section, and then after that you're taking her away and I can't see her. This is Sunday night. I can't see her until Monday at 5 p.m. Crazy. Never had I ever heard anything like this. When you're talking about wanting to lose your shit, I want to lose it. And I had to keep it together because I'm like, okay, you can't snap off. You need to just be calm and let them do what they're going to do, because at this point, it's just what's going to have to be. So I was just trying my best not to just lose it. And I was having a hard time. But anyways, what could I do? So at 11 p.m., Andy gets the update. And this is when we find out that she was at 10 centimeters and that they had whisked her off to surgery. So now Andy's waiting to hear what's next, because they had said that someone had to sit in the waiting room until 5 a.m. That someone was going to be me. Or basically, I had to sit in the waiting room till 5 a.m. just to make sure nothing went wrong. Yeah, but that's okay. Just sit in a waiting room. No, there's nobody coming to say anything unless anything went wrong, and then at 5 a.m. I could just leave if I hadn't heard anything. They eventually changed that to I just needed to sit there for 2 hours after surgery. So I ended up sitting in the waiting room until about 2:15 a.m. And no news was good news. They don't come tell you, yeah, it's good, you can go. Nope, you just time it and you leave, because that means she's great, go home. So when they come out at 11 o'clock, they're like, that's when they told us they were having the C-section. And then maybe like 15 minutes later, I get a screenshot from Andy, and it has the baby's weights and the time. They were born at 10:50 something, 10:51, 10:52 or something like that. So while we're thinking that she's being taken into labor and we're getting these updates, it had already happened. They had already been had, and she was in recovery. And so now it was my job to go sit in the waiting room to make sure nothing went wrong. So we went, and I sat in the waiting room until 2:15. Then we went home, and they give you a list of things you can bring, and they're very particular about this list. The other thing is, if you're going to have a C-section or a surgery at a hospital here in Mérida, Mexico, especially, I don't know if it's a thing at the private, but at the public hospital, you have to donate. Somebody has to donate blood on your behalf. So I needed to go to the other location because they were not accepting blood at the maternal hospital for whatever reason. So I was going to have to go to the Ultrasounds in Centro to donate blood the next morning at 7 a.m. And then, which they have to get out there at 6 because they only do like 20 people a day. To donate blood and bring proof that I donated blood. So they give you this slip that looks like this. This says basically, I need to donate blood and on behalf of whatever patient or whatever. So it's just a little slip like that. It's a piece of paper, again, a lot of paper happening. And I was supposed to do that. So I had already arranged everything to go do that morning. And the next morning, actually, before she was discharged, because she was supposed to be discharged on Tuesday. So they give you a list of things you can bring, and they're very specific about what you can bring for them in the hospital. There's no cell phones. You can't even take a cell phone. When you go up to visit them, they lock your things away. And by lock away, I mean they're just behind a desk with somebody there, and they give you a little key. Not even a key, a little tag. Just says it's your bag. Let me try. So she was supposed to be discharged Tuesday. So I go there Monday. I take the things Monday morning. So the things they say you can bring is you can bring 1 pack of pads. You can bring a hairbrush. You can bring, you need to bring a pair of slippers that are clean or new. Something to wear to go home. Something for the babies to wear to go home. Your toothbrush, your shampoo, and that's pretty much the bulk of the list. And those are things that you can bring in the hospital. So I bought these items to the hospital that morning at 9. Well, Andy takes them in, and they send out the clothes for her and the baby saying, we don't need those, we'll take them in the morning. Now, I don't know why. They still were in the same bag. It was not like it was multiple bags and everything. It was all in one bag. So why they made it a big deal behooves me. I don't know. A lot of this stuff just really started to get on my nerves, and I was just really getting fed up with it. So we take the stuff home. I go home, and I can't go back and see them until, again, visitation is not till 4. So I'm going to have to now take an Uber down here to come see her at 4, so I can see her and the babies. Because at this point, all I know is that, yes, they're okay, but we have not seen them. I'm just taking their word for it. Literally, my daughter and my grandbabies could have been dead somewhere, and they could have just been telling me they were well, and I would have been none the wiser, because there was no way for you to see or to know any differently. And that was just that. And I heard many of people going back and forth saying, like, you tell me one thing, you tell me this, and I'm understanding this. They're saying this in Spanish. Again, I'm hearing them. They're complaining, like, you told me, like, there was one mom there, she was fussing, like, you told me I could see my daughter and last night, and now I can't see her till this time, and you're telling me to go here, and I come, and you say that's not right and that's not right. And she was having a fit because, again, they give you a lot of mixed information. So I go home, and, at this point, I'm just still so, like, I'm just out of it, right? Because, again, I've not talked to her. I've not seen her. I've not seen them. They've not given us video, pictures, nothing. We just have what they said, that they're fine, that she's fine, and that the babies are with her. So I go home. What can I do? I have all these hours that I have to wait. Now it's like 10 a.m. and I still cannot even physically lay eyes on them to, at the earliest, 4:30 p.m. So I just go home and I wait. And then we order Didi, Ron, Roman, and myself to go. And it's now River's birthday, because the babies were born on December 28th. River's birthday is December 29th. And I've not seen him because he's with a friend whose house we were at for dinner. They ended up just being, him and Race were with her, so she kept them, and it was a whole thing. But, so I hadn't even seen my baby to tell him happy birthday either. But it was just so much going on. So we take a DD and we go back down there to see them. So I go in and I'm waiting, and so then the lady comes, she starts calling people, so then she calls my name. So then she starts speaking to me in Spanish, real fast Spanish. And I understand the bulk of what she's saying, but she's like, la ropas. I know she's talking about clothes. So I'm thinking she's telling me I need to go put on like maybe like a gown or something to go see the babies because they're new or whatever. I don't know. I'm just thinking maybe this is what they want me to do since there's so many different things happening here. But what she was saying is, oh, can you go get your daughters and the baby's clothes to go home because we're discharging them. I'm like blown away because it's not even been 24 hours and she had a major surgery. She had a C-section and you're discharging. They're like, I'm like, so she's going home to mi casa? Like, mi hija, los bebés, to mi casa? And she's like, sí. I'm like, what? Like today? And she's like, yeah. I'm like, okay, well, let's go. We're going to go home then. All right, so she's like, well, you need to go find out how much you need to pay for us. Because, again, we've been asking this whole time, how much is it going to cost to have these babies? We have no idea. We're in the dark. Like, we're already telling them, okay, we have limited resources, so we kind of need a heads on this to know what we need. So we need to try to figure out some things, like we need a heads up. Now, we can't tell you until it happens, because the way the public hospital is, they charge you for what you use and what they do. So they don't have a set price because it's based off the individual. And yeah, so I'm like, okay. So I was like, well, I don't have the clothes. I'm going to have to go back and get the clothes because y'all sent the clothes back home this morning. Like, I bought the clothes, y'all sent them back. Because you said you didn't need them. The clothes, we don't have a car. We had to take a ride share car here. Like I told her, Dee, she know what it is. I'm like, so we don't have the clothes. So what? I'm like, so she's like, okay, well, you can go get the clothes. They can get discharged at 7 or 9 p.m. Okay, great. It's like, okay, right now it's still like 4:30ish or whatever. So I'm like, well, okay, fine. Let me see them first before I go find out how much we need to pay and shoot back to the house to get the clothes so we can come back and do this rodeo again. So she takes me over to go see them. Again, you have to lock up everything. You can't take a phone. You can't take your purse. You can't only take your person, your body. That's it. And I understood that this was a public hospital. I knew I was not going to be able to stay the night with her. I was not expecting any of those things, but I did expect to at least to be able to see them after surgery and after birth, and that did not happen. Not until they say you can. So we went up, I saw them. She was in a bay room with four of the mamas. At this point, 2 of them had already been discharged, so it was just one and her left, and just curtains separate them. There's no TVs, there's no telephone, so she's literally just in a bed, in a curtain, babies. That's it. No clock, have no idea what time it is, no nothing. So she's really just there. And so I get there and I see her, so I'm relieved because she's fine. She has both of the boys. They're fine. So I began to look at them and I'm like, oh my gosh, they're so beautiful. They look just alike. And they're Dada twins. They had separate sacks and everything. So we didn't know if they were going to be identical because with Dada twins, you don't know. They can or cannot be identical. That's the thing with them that makes it so beautiful, right? And so I just looked and observed and I touched and I held both of them and I gave her a kiss and I was just like, well, I'm glad, okay, everything went well. She told me about the surgery. She said her doctor did speak English, which was great, and that he even held her hand when she was given the epidural, or if he saw her looking uncomfortable, he comforted her. So I was happy to hear those things. And then she had a nurse that spoke English, and she said she only had one nurse that was like really, really like just bad, like she was in pain, and she asked the nurse for like pain medicine, and the nurse just disappeared, and she ended up having to start yelling because there's no call bells either. So if there's an emergency, you can't pull a cord and be like, help, help. No, you have to just use your voice and yell, or wait till somebody decides to make a round and check on you. So those were those things that were different. Again, they're saying she could be discharged. It hasn't even been 24 hours. I didn't think to ask had she had a bowel movement. They didn't even make sure that was a thing, which is normally a thing that has to happen when you have surgery before you're being discharged. But hey, we're in a different country. We're just going to go with what they're saying. And at this point, I'm tired of the games with them. So let's just go home and we'll figure this out ourselves. So I'm like, okay, well, let me go get the things so we can go home, so on and so on. So I go back home. Again, order another DD. At this point, I've made this is my 4th trip to this hospital. Yes, and it hasn't even been 24 hours. Again, and it's 30 minutes away from us. So that's not a short commute, and that adds up when you're paying for DVs, because the further the distance, the more they cost. So we head back to the house just to get the clothes for her and the babies. I didn't think to bring receiving blankets or anything like that because just didn't think of it. They don't require car seats, so we didn't have anything like that. I had called a friend, and she came and picked me up to take me to get them. So we get back down there, and it's 6:45. They told me I could pick her up at 7 or I could pick her up at 9. She was like, please come at 7, Mom, I'm ready to go. So we got back down there. I get in. I'm ready to pay. And he's like, oh, no, you're going to have to wait a shift change. You need to be here before 7. I said, I am here before 7. It's 6:45. Oh, no, before 7 is 5 o'clock. And this is where I lost it. This is where my voice became elevated and I started to shake. My eye color changed a little bit, not too much. It didn't flip all the way out because I still, I was being conscious. But I said, I was here at 5 o'clock. Literally, I was here talking to you. You told me that I had to go back home to get the freaking clothes that I had already bought up here this morning that you sent back to the freaking house because you said you didn't need them when they could have sat in the same damn bag that the other shit was sitting in that was on the cart anyway. They were not in the way. I don't understand what the issue is. I was here. You know I was here. I was talking to you. So I'm like, I'm livid at this point. And they're like, I'm sorry, shift change. So then this guy, he comes out. He's an engineer at the hospital and he speaks English. So he starts like, I'm so sorry. Yeah, this is what happens. Da-da-da-da, but you can just wait here. So now I'm supposed to sit here another 2 hours. Like I haven't been doing this. Like I wasn't here till 2:30 this morning. Like I wasn't back up here at 8 o'clock this morning. Like I wasn't back up here at 4 o'clock. Like I'm not back here now. Like what are we doing? What are we doing? Like, cause what's gonna happen at 9? Like, are we really getting out or are we gonna say something else crazy then? So like, no. I was like, so, okay. So I go to my friend, I'm like, they're not gonna let her go. Because again, she can't come inside, because only one person can come inside. So at this point, it's just me. And I'm just like, you can leave, I understand. I'll just sit here and wait, and we'll figure out how to get home, me and her and the babies. I'll figure out if I have to order Dee or if I have to call Andy, because she was working. It was just a whole thing. So at this point, like, y'all, I was overly frustrated. So she worked it out where she could stay with us and end up just inconveniencing her evening to do what we need to get done. So we waited. So about 8:30, the engineer comes and he waves me. He's like, come on, you can come now. And so I had to go pay. So I go pay. That's when they gave me the extension on donating the blood because you're supposed to donate the blood. That's part of discharge. So you have to show that you donated blood to actually for them to be discharged. So I hadn't did that because, again, I was going to do that Tuesday morning because I knew I was able to pick her up before noon on Tuesday. At 11 a.m., basically, Tuesday, we could pick her up. So I was going to go donate blood and then be there to pick her up. But since they expedited her discharge to Monday, they gave me that piece of paper. They said, oh, you have a 1-day extension to donate blood. So they wanted me to literally get out, take her from the hospital that Monday night, and then Tuesday morning go donate blood and bring it back to the hospital. After I'd already done 5 trips to this hospital, that was not happening. I was not. At this point, I'm going to have to be home with her and the babies. What do you think is going to happen? She's going to need help. All right, so I go to pay. So let's talk about what it costs, what we had to pay. So at this point, they give me the receipt or whatever to show like, okay, this is the cost of everything, like of everything that she used in the hospital. So the cost of the cesarean was 4,561 pesos and 20 cents. Pesos. So 4,561 pesos was the cost of the cesarean. Then there were other things they did like the observation, the hospitalization for 1 day. So the room for 1 day, even though she didn't have 24 hours there, was 192 pesos. To be observed for that day was 199 pesos. Then there was, this is all in Spanish, I'm just translating it as I'm reading it. Then there was, I don't know what this thing is. There was something, I don't know what that is, so I can't tell you what that is. But apparently they did some glucose that was 39 pesos. Yeah, so, I mean, the total cost for everything out of the door was 5,460 pesos. 5,460 460 pesos. So, where in the world can you have a baby for less? So 400 USD, have 2 babies, have a C-section with twins, and stay overnight, and that includes anesthesia that covers the doctor costs. Now, the midwives charge $3,000 here. That's why we didn't use a midwife, because they're charging more than the damn doctors. And most of them are not even qualified or not getting the birth certificates and doing the things they need to do. So why would I go through that hell? But yeah, so again, 5,460 pesos for all the pain and the hell we endured, all the inconsistencies. But they did manage to deliver the baby safely and take care of my daughter and get her out safely. So once the babies are born, when you're in the hospital, they receive these little books like this that you take with them. So since we have 2 babies, we have 2 books, and it's the record of their birth. So now we have to go to the record place to announce their birth and get birth certificates, and we now have first generation Mexicans in our family. So that was our experience. So if you're in Mexico and you find yourself pregnant and having to have a baby at the public hospital because you can't afford to have a baby at the private hospital, just know that your experience will be something like that. But you've been warned, so you have way more heads up than I had, because we were literally in the blind. Nobody knew how to navigate this, not even my Mexican friends, because they've never utilized public health care for child labor. All the Mexican friends I have that have kids, they did private experiences or they did home births. So they were not familiar either with this, so they couldn't help. So again, it's not like you're not going to get the care you need. They have, the doctors are qualified, the staff is qualified, but you will experience some attitude like you will at any, I guess, hospital. That's normal. So that didn't surprise me. You get that at the States. I don't care where you're at. I'm just like, why do you decide to be a nurse or even in this field if you don't want to do it? Just pick a different job, but hey, it happens. But I say all that to say, despite the hell and all the chaos, they successfully delivered 2 beautiful boys that we now have here in our home with us. So please like, comment, subscribe, share this video with anyone you know that may be considering this. Even if you just come here to visit, like you're on vacation here in Mexico, anywhere in Mexico, and you get caught off guard and you go into labor, go to the public hospital. They will see you, and you will pay substantially less than you would if you go to a private hospital. So just something to think about. Will it look like maybe you wanted to look? The hospital was clean. I can say that. It was clean. Yeah. So, what more can you ask for when you spend that amount of money? So until next time, this is Mimi saying adios, hasta luego, peace.